So, hello students, our today's subject is oral surgery. So, let us discuss the MCQ. The first question is, a patient had a fall resulting in mid-symphyseal Gaudsman fracture. While reducing the fracture, the lingual splaying of the segment was noted. So, this will cause an increase in. So, the answer is C, that is the interangular distance. So, first of all, the Gaudsman fracture is a symphyseal and bicondylar fracture that you should know. So, a Gaudsman fracture, it is a symphyseal and bilateral condylar fracture. So, here in this CT scan, you can in the CBCT you can see this one. This region is showing the mid symphysis region fracture. So this region getting fractured and the bilateral condyle fracture. So for entrance exam, you have to just remember that the Gaudsman fracture, it is symphyseal. Remember. And bilateral condyle fracture. So it is the other name is, remember, the other name is, it is also known as parade ground. Parade ground fracture. So it is also known as parade ground fracture, symphyseal and bilateral condylar fracture. So the lingual splaying, what does that mean? The lingual splaying in the question means that there is outward displacement of the separation of the lingual surface of the fracture bone. So you will see there will be separation of the lingual side of the fracture bone will get separated, particularly in case with the symphyseal fracture. Along with so here there will be separation on the outer surface. So symphyseal fracture, it's a fracture in which involving the midline of the mandible where the two halves of mandible they will meet. Whereas the lingual splaying, it refers to the inner side facing surface of the mandible. So when the fracture segment, they are displaced outerwards on the lingual side. So this outward movement will cause the lingual surface of bone to spread apart. So it will create a gap or separation between the teeth. So it can affect the alignment and stability of mandible. So what you will see, there will be malocclusion, difficulty in chewing and speaking. So proper reduction, realignment of the fracture segment and adequate fixation, they are required to restore the normal function. So the interangular distance means the width from the angle of that means that width or distance between the two angle of mandible. So the interangular distance, it is distance between angle of mandible So lingual splaying of the mandibular fracture, in case with the Gaussman fracture, it can cause increase in the interangular distance. So that is because the splaying or spreading apart of the fracture segment that can result in wider separation between the mandibular angles. So option A is interpupillary distance. Well, the interpupillary distance is the distance between the two center of the pupil of eye. So that cannot be the answer. Intercanthal distance, it is the distance between the inner corners or the canthal of the eye. Even that is not the answer. Option D, Gonian-Ganathian distance. It is used to measure the length of the mandibular body. So this Gonian-Ganathian distance is primarily concerned with the length of the mandibular body rather than the width of separation of the angles. So answer of choice is the interangular distance. Option 2. Let us discuss the next question. What is the recommended needle withdrawn technique after the administration of intraligamentary anesthesia? So your answer is leave the needle in place for several minutes after the injection. So this technique here shows the intraligamentary injection. So after administration of the intraligamentary anesthesia, it is recommended to leave the needle in place for several minutes. So that allow for the better diffusion and distribution of anesthetic solution within the periodontal ligament space. So this space. So that can enhance the effectiveness of anesthesia. So leaving the needle in place for a few minutes helps to ensure that anesthetic solution has sufficient time to take before the dental procedure is being performed. So this intraligamentary injection technique, as described in this pic, it's also known as periodontal ligament injection. So this technique involves the injection solution. It is given directly into the periodontal ligament space. So it's given in the periodontal ligament space that surrounds the tooth root and connect them to the bone. So you have to just insert the needle into the gingival sulcus or directly into the periodontal ligament space. So the needle should penetrate gingiva and reach the periodontal ligament space. Perform an aspiration by pulling back slightly to check for the blood. Administration, a small amount of 0.2 to 0.3 ml of the solution into the pedial ligament space. So remember, while injecting, you have to leave the needle in place for several minutes after the injection. So answer is B. So that helps to ensure that anesthetic solution has sufficient time to take effect before the dental procedure are performed. That will increase or enhance the effectiveness of the anesthesia. There will be better diffusion and distribution of the anesthetic solution within the periodontal ligament space. Next question. During a lingual nerve block, the needle is inserted into which area? Well, during a lingual nerve block, the nerve, it is inserted into the sublingual space. So this one is the sublingual space. So this nerve block technique, it is used to anesthetize the lingual nerve that will provide the sensory innervation to anterior 2/3 of the tongue. So anterior 2/3 of the tongue. So the solution, it is injected into the sublingual space to block the nerve effectively. So our goal is to anesthetize the lingual nerve. that provides the sensory innervation to anterior two-thirds of the tongue. So to effectively block the lingual nerve, the injection needle is typically directed close to the lingual nerve pathway without directly touching it. So you have to give the injection in the sublingual space, that is located beneath the tongue and within the oral cavity. So the needle, it is inserted into the sublingual space. It is positioned in proximity to the lingual nerve, and once it is done, just deliver the anesthetic solution. You have to just deliver the anesthetic solution so that it diffuse and block the nerve function without causing any direct injury to the nerve itself. So answer here is A. Another question. During a Govt mandibular nerve block, the patient experienced paresthesia in the ipsilateral ear and posterior one-third of the tongue. So, what nerve could be inadvertently affected in this case? The answer is auriculotemporal nerve. Well, during a Govt nerve block, where do you give? Where is your target area? The target area is near the neck of condyle. So this region is your target area. So targeting the mandibular nerve, a branch of trigeminal nerve. So the needle, it is inserted near the neck of condyle of the mandible, targeting the mandibular nerve, that is a branch of trigeminal nerve. In some cases, the needle may affect the auriculotemporal nerve, this nerve, that is the another branch of the trigeminal nerve. So this auriculotemporal nerve instead of this inferior alveolar nerve, sometimes your target area reaches the neck of condyle, means here, that may anesthetize the auriculotemporal nerve. So that we know that auriculotemporal nerve, it provides sensory innervation to external ear and skin over the TMJ joint. So when this nerve is affected, what will you see? That will cause paresthesia in the ipsilateral ear, same side of the ear, and posterior one-third of the tongue. So your answer is auriculotemporal nerve. Hope the answer is clear now. Moving to the next question. After an infraorbital nerve block, the patient reports numbness in the upper lip, but the teeth remain sensitive. So what could be the cause? The answer is C. So when the patient reports numbness in the upper lip but sensitivity in the teeth after an infraorbital nerve block, that the cause of it is incomplete diffusion of the anesthetic solution. So infraorbital nerve, we know it is administered to provide anesthesia to the maxillary teeth and surrounding soft tissues, including the upper lip. As the infraorbital nerve, we all know that it innervates these areas. So if the anesthetic solution, if it does not diffuse and reach all the nerve branches, or there is insufficient time for the solution to take effect, what the patient would experience an uneven or incomplete numbness. So it is incomplete diffusion of anesthetic solution. It is most likely the cause of this. So the answer is C. Moving to next question. During an inferior nerve block, the patient reports an tingling sensation in the lower lip and chin, but the teeth remain sensitive to stimulation. What could be the cause? So The cause could be accidental injection into the mental nerve. So, a tingling sensation in the lower lip and chin. So, if during inferior alveolar nerve, the goal is to anesthetize the inferior alveolar nerve. So, if the needle it anesthetizes the mental nerve, a branch of inferior alveolar nerve that is responsible for innervating the lower lip and chin, it can lead to numbness or tingling sensation in those areas. While the teeth, they may remain sensitive. In Govt mandibular nerve block, which nerve block is primarily anesthetized? So we know the Govt mandibular nerve block, it is technique that is used to achieve a profound anesthesia of the entire mandibular nerve division. The main target of this block is the inferior alveolar nerve. So that provides sensory innervation to the lower teeth and surrounding structures in the mandible. As we know, the primary target of the inferior alveolar nerve the injection for the inferior alveolar nerve, it is given near the mandibular foramen, that is located at the posterior border of the ramus of mandible. So the anesthetic solution, it is delivered close to the mandibular foramen, whereas so our target area in that inferior alveolar nerve block is the lingula, whereas in the Govt mandibular nerve block, a profound anesthesia of the larger portion of the mandibular nerve is our aim. So the primary target is the mandibular nerve itself, which includes the inferior alveolar nerve and other branches of trigeminal nerve. So our target area here is the neck of the condyle. So the Govt technique, it does not anesthetize only the inferior alveolar nerve block, but it also anesthetize the other branches of mandibular nerve like the lingual, buccal, mylohyoid nerves, that results in more comprehensive numbness in the lower jaw, teeth and the surrounding soft tissues. So the primary nerve anesthetized is the inferior alveolar nerve. Next question. A patient presented with a tingling sensation in the tongue with a difficulty in the speech and swelling. So which nerve block has been affected? The answer is the lingual nerve. Very easy question. Moving to next question. What should the dentist do if the patient experiences an adverse reaction following an inferior alveolar nerve block? So if the patient experiences an adverse reaction following inferior alveolar nerve block or any dental procedure, the dentist initial response should be to monitor the patient closely and document the reaction. So that will allow the dentist to assess the patient condition, provide an appropriate care and maintain the record of the incidents for the future reference. So depending upon the nature and severity of the reaction, further action that may be required, such as administering emergency medicaments or referring the patient to specialist. So however, closely monitoring the patient and documenting the reaction are the essential first step in managing the adverse events during the dental procedure. So answer is definitely A. After positive aspiration, the dentist withdraw the needle and reposition it during an inferior alveolar nerve. What precautions should the dentist take before injecting the anesthetic solution. So the dentist has to aspire again to confirm negative aspiration. So when a dentist withdraw the needle and reposition it uh, uh, during the injection procedure, it is crucial important to aspirate again to confirm the negative aspiration. So you have to check whether the needle is either positioned within a blood vessels before re-injecting the anesthetic solution. So aspiration involves the pulling back slightly on the syringe plunger to check for blood. So if the blood comes during the aspiration, that indicates that the needle is in blood vessels and injection into the blood vessels should be avoided. So injecting the medications or anesthetic solution directly into the blood vessels can lead to various complications like the systemic toxicity. If the medicaments or anesthetic solution it is injected into blood vessels, it can enter the bloodstream leading to systemic toxicity that can cause symptoms like rapid heartbeat, shortness of breath, confusion, etc. It can affect the cardiovascular. It can have cardiovascular effects like the arrhythmia, irregular heart rhythms, increased blood pressure, increased BP, or even a heart attack in susceptible individuals. There could be neurological effects like loss of consciousness, confusion, paralysis. Apart from that, local tissue damage can occur, allergic reaction or hematoma can be the complication associated with it. So you have to aspirate again to confirm the negative aspiration. That is the answer of choice. A patient develops seizures and tremors on administration of LA due to the lignocaine overdose. So the level of lignocaine that cause CNS toxicity it is. So it should be. So the answer is A. It should be greater than 7.5. So it should be greater than 7.5 microgram per milliliter. So lignocaine, we know it is a local anesthetic, and excess level of it in the bloodstream, it can lead to CNS symptoms like the tremors, seizures, and other neurological disturbances can occur. So remember this value for your entrance exam point of view. Next question, a patient was on 20 milligram hydrocortisone for 4 years and was advised to extraction. So during extraction, he started experiencing lethargy, weakness and palpitation. The treatment was discontinued and he was prescribed 100 milligram hydrocortisone. What is he being treated for? The answer is C, adrenal insufficiency. So the patient here is being treated for adrenal insufficiency, also known as Addison disease or secondary adrenal insufficiency. So in this case, the patient has been on long term, the maintenance dose is 20 milligram, right? Likely to replace the deficiency of adrenal hormone production. So when undergoing the tooth extraction, the stress of the procedure could have increased body demand for the hormone cortisol. So it is a hormone that is produced by the adrenal glands. So that can lead to symptoms like lethargy, weakness and palpitations. So to manage the increased demand during the procedure, the patient hydrocortisone dose was temporarily increased from 20 milligram to 100 milligram. So that is done to ensure adequate cortisol level during the period of physical stress or illness. So as we know, cortisol, it is a steroid hormone that is produced by the adrenal glands that are located on the top of each kidneys, so that it plays a role in body response to stress. So that is why it is also known as stress hormone. So when the body perceives a stress or threat, the hypothalamus pituitary adrenal axis, it is activated, that signal the pituitary gland to produce ACTH, that stimulates the adrenal glands to release cortisol in the bloodstream. So this cortisol, we know it will cope with stress by increasing the blood sugar level. So this was the normal etiology. The answer here is C. Let us move with another question. A patient with a history of diabetes came to dental clinic for tooth extractions. While on chair, he experienced hypoglycemia and he suddenly fall down with the low BP on the dental chair. So what should be your immediate line of treatment? Well, the patient experienced hypoglycemia. So immediate line of treatment should be to give dextrose. Dextrose 50% is concentrated IV solution that will provide a rapid source of glucose. So that will raise the blood sugar level in case with the severe hypoglycemia. So that will restore the consciousness and stabilize the patient BP. So dextrose 50%, it is generally used. So answer is B, dextrose 50%. Let us move to the next question. A 35 years old patient required extraction of left upper molar, but since she presented with exophthalmos, tremors and increased blood pressure. So what should be the operating surgeon suspect? So symptoms here described in patient are exophthalmos, that is the bulging eyes. So these bulging eyes, tremors and increased pressure, so that will suggest hyperthyroidism. What is hyperthyroidism? That means there is overactivity of which gland? Thyroid gland. So that will produce excess which hormone? Thyroid hormone. Right. Exophthalmos, it is the protruding or the bulging eyes. The tremors, that are involuntary rhythmic movements that can be associated with hyperthyroidism. So answer is definitely hyperthyroidism. A 50-year-old patient with history of chronic alcoholism required multiple extractions. Which of following he should be prone to? So he should be prone to increased partial thrombin time. So the chronic alcoholism, it can lead to liver dysfunction. So liver, we know it is responsible for producing clotting factors like the prothrombin. That is essential for the clotting cascade. In the alcoholic liver disease, there will be impaired synthesis and decreased level of clotting factors that can lead to prolonged PT. So increased PT indicates there is deficiency in the clotting factors and there is increased risk of bleeding, making patient with chronic alcoholism more prone to the bleeding complication. Remember the partial thromboplastin time, it affects the intrinsic pathway and it is not affected by chronic alcoholism. Whereas the prothrombin time, it assesses the extrinsic pathway. Moving to the next question. A patient with iron deficiency anemia came for extraction of impacted wisdom tooth. Which of following would be contraindicated for such procedure? The hemoglobin level of 7 mg per deciliter, it's below the normal range, and it will suggest a severe anemia. So anemia is a condition that is characterized by the low red blood cells count. So the blood has reduced oxygen carrying capacity. So performing surgical procedure like extraction of impacted wisdom tooth can be risky and can lead to complication that is due to the reduced oxygen supply to the tissue. So A is contraindication for such procedure. A patient 58 years old came to oral surgeon with rheumatoid arthritis. The most common complication of TMJ is ankylosis. Rheumatoid arthritis, it is an autoimmune disorder that can affect the multiple joints in the body, including the TMJ. So ankylosis, it refers to the abnormal fusion or immobilization of joint that can occur as a complication of these rheumatoid arthritis. So the most common complication is ankylosis. The most common is, remember, ankylosis. So ankylosis in TMJ, it can result in severe limitation in jaw movement, difficulty in opening and closing the mouth, etc. Whereas the option MPDS, it can occur. It is not specific to rheumatoid arthritis and occur in individual without RA. The internal derangement refers to the structural abnormalities within TMJ like displaced disc dislocation or malpositioned joint components that can cause pain, clicking, popping sound, and limited jaw movements. Osteoma of condyle, it is a benign tumor that can occur in various bones, including the condyle of mandible. Osteoma can develop in TMJ. They are relatively very rare, and it is not specific to RF patient with TMJ disorder. So, most common complication is ankylosis here. A cardiac patient came to dental office with signs and symptoms that commonly suggest that cardiac failure. Him being assessed for oral surgeon are So the ankle edema, that is the swelling of the ankles, it is common suggestive of congestive heart failure. So that occurs because the heart's pumping ability is compromised. That will lead to fluid buildup in the extremities, including the ankles. Dyspnea means the shortness of breath. It is another hallmark of the heart failure. As the heart's ability to pump up blood decreases, it can lead to fluid accumulation in the lungs. So that fluid accumulation in the lungs that will cause difficulty in breathing. So other options may be associated, but they are not specific to cardiac failure, and they are less likely to be directly related to heart failure. So answer here is C. Moving to the next question. Patient receive heavy blow to the right body of mandible, sustaining a fracture there. You should suspect a second fracture. That is most likely the answer should be C. So when a patient sustained fracture to one side of the mandible, particularly in the body of mandible, in the case here is right side. So there is possibility of second fracture. So that is the second fracture, the traumatic forces that can result in fracture at multiple locations due to transmission of energy through the bone. So the fracture on the right side of mandible may be associated with the fracture on the contralateral. So fracture of it may be associated with on the contralateral side. So that is why you should suspect a second fracture in the left subcondylar region. So that is why assessing a patient with mandibular fracture, it is crucial to conduct a thorough examination, including the radiographic imaging, to identify any additional fracture that may not be immediately evident. Next question. A 65 years old woman arrived for dental therapy. The questionnaire shows that she is suffering from severe cirrhosis. So the problems that can be anticipated in the routine dental therapy is, the answer is B, tendency toward prolonged hemorrhage. So in patient with severe cirrhosis, there is concern regarding blood clotting and coagulating factor. Cirrhosis, it can lead to impaired liver function. So that can results in decreased clotting factor. There will be decrease in the production of clotting factors and platelets. So if the platelets gets decreased, there is increased bleeding. And so that is why the patient there is tendency toward prolonged hemorrhage. So the routine dental therapy like extraction, periodontal treatment, they can lead to bleeding. And patient with cirrhosis, this bleeding tendency is of particular concern. The most Culprit for the maxillary sinus infection of odontogenic origin, it is due to the anaerobic bacteria. The bacteria mostly associated are the Streptococci and Staphylococcus aureus species. So the answer is B. Moving to next question. A 47-year-old patient was suffering from severe headache and heaviness of the face since 4 years. On further examination, it was noted that there was inflammation of most or all the paranasal sinuses simultaneously. So you can see here there is so the term we use is pansinusitis. It is term that is used to describe the inflammation or infection involving most or all the paranasal sinuses simultaneously that can affect multiple sinuses including the maxillary, ethmoid, frontal, sphenoid sinuses. So the term is pansinusitis. A 8-year child was diagnosed with fracture in twin jaws and it was further noticed it was a single fracture line. What is the best way of treating such a fracture? The answer is cap splint fixation. So the cap splint fixation involves the use of orthodontic appliance or cap splint to stabilize the fracture jaw. So it is common method of treating single fracture line in both jaws, especially in the pediatric patient. So this will allow to align the jaw properly and promote healing of the fracture. The intermaxillary fixation that involves the wiring of the upper lower jaws together to immobilize them. The Rifden wiring, it is used for the treating mandibular fractures. Transosseous wiring involving the passive wires through the bones to stabilize the fractures. So that technique is used for certain types of fracture, but it is not the primary method for treating single fracture line in the both jaws. A 20-year-old patient met with bike accident and CT revealed a disc unfavorable fracture in the mandibular angle region. So during surgery, it was seen that it was a fairly difficult fracture to treat. This might be because of distraction of the fragment segment by the muscle pull. So these are the muscles that will make it unfavorable fracture. So a display of unfavorable fracture in mandible angle region, it is challenging to treat because of the muscle forces in this area. The muscles that are attached to mandible, like the masseter pterygoid muscle, they can pull the fracture segment that will make it difficult to align properly during the surgery. A 40 years old female with clicking in her right TMJ for last 6 months. She does not have any pain or limitance of her mouth opening. The clinical examination does not reveal odontogenic cause. What could be the most likely represents? The answer is C, internal derangement of TMJ. The most likely condition here is TMJ. The clicking or popping in the TMJ without associated pain or limited mouth opening, it is presented with the internal derangement of TMJ. It can involve like disc displacement, condyle dilation, disc condyle abnormalities, etc. The patient with internal derangement may experience clicking, popping sounds as they open or close their mouth. Whereas the TMJ ankylosis, it refers to the immobility of the fusion or immobility of the TMJ. that would result in limited mouth opening. Fracture of mandibular condyle could lead to pain, swelling, and limitation of the mouth opening. Myofascial pain, it involves the muscle related pain and it is not directly related to TMJ clicking without other symptoms. So answer is C. A female patient complained of pain in her right ear radiating toward the angle of mandible. Clicking sounds were present in right TMJ joints. Result of palpitation and radiographic examination, they are negative. The most probable diagnosis, it is C. So myofascial pain dysfunction syndrome, MPDS, it is condition that cause pain and dysfunction in the muscle that controls the jaw movement. So that presents with the ear pain, jaw pain, clicking, popping sound in the TMJ and referred pain to the ears and the surrounding structures. Osteoarthritis of TMJ, it may cause pain and limited jaw movement but involves the radiographic changes, like you will see the joint space narrowing and bone changes that are not mentioned in this case. So that's not the answer. Rheumatoid arthritis, it can affect the TMJ and cause pain and dysfunction, but it is usually associated with other systemic symptoms. Traumatic arthritis, it occurs after the specific injury to TMJ. It can cause pain, dysfunction, and it has a traumatic event associated with it. So answer is C. Alchemo index, it is used for objective evaluation of TMD disjunction. It was asked in your recent exam. It is used to classify TMD, temporomandibular joint disorders. The interposition materials that restrict the heterotopic bone formation in patient treated with TM ankylosis with the fat. So in the patient treated with the TM joint ankylosis, the autologous fat graft. So the fat graft, they are used as interpositional material during the surgical procedure. So why we use them? We use them because the purpose is to obliterate the dead space around the joint prosthesis. So that would restrict the formation of hematoma in the joint space. So that can limit the heterotopic bone formation and promote better outcome following the TMJ surgery. Deep antegonal notch, it is a feature of TMJ ankylosis. So this is the difference between the unilateral ankylosis and bilateral ankylosis. So very important question, very important to know that in unilateral there is deviation of chin to affected side and bird face deformity, it is seen in bilateral TMJ. So remember all these differences between unilateral and bilateral ankylosis. In unilateral ankylosis, you will see flattening and elongation on unaffected side. In bilateral, the mandible is symmetrical but micrognathic. So there will be retrognathic mandible. Moving to question, the new concept in etiology of TMJ ankylosis, it's the hypercoagulability of the blood. So hypercoagulability of the blood means the blood, it has increased tendency to clot. So TMJ ankylosis, it can result from, as we know, that can result from the trauma or injury to the temporomandibular joint. So this trauma can lead to bleeding and hematoma, that is accumulation of blood within the joint. So in individual with hypercoagulability state, the blood is more prone to clotting. So when trauma will occur, the hypercoagulable blood, it will form more clot more readily with the joints, including the small blood vessels. So the blood clot will organize, leading to formation of fibrous tissue. So this fibrous tissue can result in the fusion or ankylosis of TMJ. So as the fibrous tissue accumulates and harden, it can restrict the normal function of TMJ that can cause ankylosis. So it was asked in Ames SR shape exam